Here with Bob Leonard, who is actually, I'm going to just brag on him for a minute, one of the top hair surgeons in the world, because I don't think I've ever said congratulations on your Golden Follicle Award.
Well, thank you very much.
And it does mean that, right? So you were kind of voted by the top age governing body or membership body of hair transplant surgeons, gave you this award.
I'm very proud of earning the Golden Follicle Award from the International Society of Hair Restoration Surgery. It's an award that's given every year by our organization to honor somebody who is very involved in teaching and good patient care and service to the International Society of Hair Restoration Surgery. So it's been a really great honor for me to be a recipient this year.
That is so awesome. Congratulations, seriously. You know, we were talking a little bit before we went on, and I hear from people all the time. Some people think there's absolutely nothing you can do about hair loss. Some people think there's 100 things, they just really haven't found the right one. That's not really true though, right? The medical community actually has things it recognizes to help stop hair loss and help cause hair regrowth.
Most definitely. There are a lot of treatments that are purported to treat hair loss. The real answer about the medical treatments of hair loss are really very few in number. One is Rogaine, or the drug is called minoxidil, Rogaine or minoxidil. And that particular medication is applied to a person's scalp twice a day, every day. It works all over the head, the front, middle, and back, and it has to be applied twice a day forever. So it's a medicine that's easily available and easy to use. It has to be used forever because if you stop using it, the benefits you use will reverse after stopping it for about 8 months. So people have to know that in advance, but it's available. A second medication is called Propecia or finasteride. That's taken in pill form. So you take this pill once a day. It works specifically in the back of the head, the crown of the head, and it has to be taken also long term. There's some side effects to Propecia that people need to be aware of, and that's something they would talk to their doctor about. Another treatment is photobiomodulation or low-level laser therapy, which has been around for many more years than people realize, the technology of which has advanced dramatically in the very recent past.
Okay, and is that male or female? Not to interrupt, but I want to make sure we get it. Male or female for that one?
Photobiomodulation is great for men and women alike.
Okay.
And very recently, a totally new type of technology has evolved that is a different type of laser. All the other devices on the market have a particular type of laser. This one is different. It's SMT, surface mount technology. So the typical laser in most devices out there is a round circle, and it has a particular depth of penetration into the scalp skin, and it also is a particular round, small size. The new type of laser, which again is called surface mount technology or SMT, is a wider laser beam. And the wider the beam, more blood vessels could be positively affected in the scalp. The other difference is the SMT will actually go deeply into the scalp. And that's where the blood vessels are that do all the work to treat hair loss. So it's a great technology, it's very new, and it's something I'm extremely excited about.
You're saying light's going to regrow my dying hair. How is that all working scientifically?
Well, back about 28 years ago when this technology was first introduced to treat hair loss, someone said that to me and I said, you've got to be kidding me.
Yeah.
How can that be? Over time, I really learned that this type of technology, low-level laser therapy, is really the best non-surgical therapy to treat hair loss in men and women because it works.
Yeah.
So I spent 2.5 decades using this type of technology on patients, and the problems in the early days were inconvenience. People had to come to the office for many, many treatments in a year.
Oh, so they would pay per treatment at your office, you're saying?
Absolutely.
But now they can do it at home, so that is a big deal.
That is a huge deal because, you know, having to go to a doctor's office is fine, but when you do it so many times, then it's very, very disruptive to your life. And then the new technology came on with a cap-type device, and it was a half hour every other day, which was a lot better than going to the office, but certainly a little inconvenient. And now we have a device in the A300 that's only 10 minutes a day. I have more experience than most doctors in the whole world of actually seeing with my own eyes how well low-level laser therapy works. I think it's a fabulous treatment, easy to use, very effective, and it's magnificent, in fact. It's cleared by the Food and Drug Administration for both safety, which is important, and efficacy or the benefits. So what more can you ask for?
Yeah. Interesting. Dr. Robert Leonard, fascinating. Thank you for your time. I appreciate it.
My pleasure. Thank you.